Thank you, Mr. President. Thank you for your leadership and vision and finally getting to closure on this issue. This is a question, a scientific question, that has divided our country for many, many years. And there are valid claims on both sides. On one side, patients and physicians attest that cannabinoids and THC can have miraculous effects on chronic pain, on epilepsy, on PTSD, on chemotherapy-induced nausea. My friend Howard Kessler, without whom we wouldn't be here today, drove this change in the schedule. And he did it because of his own experience in mitigating the impacts of chemotherapy. He has nothing to gain from this. He just saw something that worked for him, that worked for thousands of other Americans, and he wants to make it available to them. On the other side, there are valid claims about the negative impacts, about addiction, about psychosis, about adverse public health impacts, and impacts particularly on young people. So we haven't been, the evidence on all of these is anecdotal and it's hypothetical because we have not been able to do scientific studies. There is no standardized dosing. And if you don't have standardized dosing, any study that you do is comparing apples to pears. And we don't know the difference between botanicals and synthetics, and all of these questions we're now going to be able to answer. 5 administrations have promised to act on this issue. The Biden administration promised to do this, and the proposal began during the Biden administration. It got mired down in the chaos and inertia and disorganization of that. And I want to thank President Trump, who made the promise during the 2024 election that he was going to come in and solve this issue, that he was going to take decisive action, and he has kept that promise today. And so thank you, for President Trump, for your vision. And because of that, we will have answers very soon. This will finally allow us to study this issue and to answer these questions for the American people.
Thank you very much, Bobby. Howard Kessler, a friend of mine, one of the most successful people in the country, came to see me on more than one occasion, actually. And he had some real difficulty about 3.5, 4 years ago, and he went through hell. And during his going through hell, he probably sampled everything you can sample when you're going through that, Howard. Sure. And he came to me, he said, there's been nothing like this, and we're going to have to take a good, strong look at it, and that's what he asked me to do. And others have likewise said that, many others. I mean, you know, again, I've never been inundated by so many people as I have about this particular reclassification. And I don't know that you have anything to say, Howard. If you'd like, you could say whatever you like.
I just want to help the people 65 and over and make a difference in their lives. And we have machines and talent that could do it, not in 8-year clinical trials, but in a year. And we're going to prove that may change the world, really, in healthcare. So thank you, Mr. President.
And I'm far younger than 65, so this does not pertain to me. Thank you. I don't want it, okay? I'm not going to be taking it, but a lot of people